Okay, my friend, that's it. Be just a little bit here, okay?
Okay, you want me to put this stuff
You
on?
can get, let's see, get your gown yet, let's see. Get that gown on, okay? You can leave it on, the nurses will come on back in, and you can cover the top with just, okay? Okay. All right, we'll see you later. Bye-bye.
See you, thank you.
My pleasure. Okay, all yours. Thanks, yeah.
The only thing I'm worried about is this going in my hand. I ain't never had nothing going in my hand before.
Did I tell you where to put your stuff? Clothes here and shoes here.
Yeah.
And then this, you don't have to put it on now, but you can.
Mm-hmm.
You can put it on like the moment you roll out of here. Okay, because a lot of people think it gets really hot on the head.
You don't want to just take my stuff with you?
Huh?
You don't want to just take my stuff with you? What's the difference?
I'm saying, what you gonna go home in? That, right? Right, so you need a beer. Why would I take it with me?
I'm saying take it with you, meaning when you go, because my book bag out there.
No, I'm gonna take your book bag with me. Or when they put you in your room after you're done, your book bag can go up there with you.
Did he mark you?
Yeah.
Did he mark you both sides?
Yeah.
Yeah.
Okay. Okay, so you're doing that. And then, did you sign consent?
Yeah.
No, not yet.
I think I did at the,
At the office?
Yeah.
Okay. Sorry.
she act like she's slow or something. Or is it just me? Huh?
Huh?
She act like she's slow or something, or is it just me?
I don't know, maybe she nervous, I don't know.
Alright. Should I keep my phone with me? Like in the bed with me?
You're gonna come off of this bed and go to on another bed, the operating table first. So you can leave me with your phone.
Or put it in my drawers?
You're not gonna have nothing on when you go to your surgery.
Why not?
You're gonna be asleep.
I'll keep my drawers on.
Ask them about that. Gosh, you was funny as hell.
Oh, just doing your stuff together. Hi. I'm Yolanda. I want you in the streets and start your IEP.
Okay. So since you're the anesthesia people, maybe I can ask you this question.
All I do is start the IEP. I don't even have no drugs for you.
Oh, that's crazy. So you think I can keep my pants on?
Oh, I know you can't do that.
Oh, man.
That's what I told her. You have to be naked.
No socks that come off, no underwear, nothing. Birthday suit.
What?
They probably let her keep her socks on.
No, those great, those. You gotta put those on.
Yeah.
Yeah. Not over yours. Okay, none of that. Okay, I do that.
Yeah, birthday suit.
Birthday suit is crazy.
Yeah, that's what they do, because you can't take germs into a sterile room.
Oh, you're right. You're right when it comes down to that. Okay.
Told you, I'm working surgery in the brain.
What is this? My glasses.
Yes.
These too big.
Yeah.
Thank you, Lord. That's crazy. I gotta take all my clothes off. Right now? So I put my pajamas on, so I ain't have to strip. I can't keep my drawers on.
Huh? Girl, you on the camera.
I'm editing it. It's gonna be like,
Oh, ass out. It's another tie thing on there.
he ain't tied. I gotta take this out too.
She said that. She said you gotta put that on your head, but she said she don't recommend putting it on now because you get hot. What's wrong on it? Tell him he better sit tight, and he got my sandwich and shit.
I'm still one of these. Can I get that?
Yes.
Thank you. Okay, as y'all can see, you recording for 34 minutes. As y'all can see, you know, I done got dressed. Y'all done seen what's get done. So, I'm gonna keep y'all up to date. I gotta stop it and let the, you know, feel me?
You had IV on here before? They're not comfortable. I like when people tell me, yeah, they had one.
No, I don't even. I ain't never had this before.
That's how the lucky one.
Now, I ain't scared of needles, though.
Yeah, what's gonna be going in?
They said that they running behind, so I don't know.
I'm gonna flush it with some sterile water to make sure it's working.
Okay. I feel weird.
Alright, so I'm gonna apply this up behind your ear. There. Okay, a slow patch is just a little tiny patch that goes behind your ears just to prevent nausea and vomiting. So don't touch it, please don't touch it, because sometimes the medication seeps out, and if you touch it and touch your eye, you can severely injure your eye. So don't touch it.
No, I ain't gonna touch it at all.
We just have to stress on it because it was an iron.
Alright, so y'all, it's currently 1:22, and I'm supposed to be having surgery right now. But as you know, even though they ain't black, Chicago is just black. So you know, nothing ain't been never on time, nothing. So they already came in and drawn on me, as y'all can see, and yeah, she put this IV in. It's really irritating. I don't think I ever had no IV in my hand before. Not that I know of or remember. But for sure, irritating. My mama over here watching Zeus. Feel me? She done got in the Zeus and stuff. And she been over here watching this since. I'm trying not to turn on my show, you know? But I can't wait to eat, though, when I get up. That's what I do know. I cannot wait to eat. I ain't starving yet, but it's coming. So yeah, we just waiting. I don't know how long we're gonna be waiting. Probably to 5. Hopefully not. So we gonna see.
Fluids to this IV, make sure it runs okay. Might feel a little flush. Alright, looks great. Can you tell me your full name and what we're doing today?
Mastectomy and possible lipo.
Perfect. Last time you had anything to eat or drink?
Like 8 o'clock yesterday.
Any problems with anesthesia in the past?
No.
When have you had it before?
When I was 9.
Gotcha. No, it didn't wake up nauseous or vomiting. I guess mom can answer that better than you. Okay, perfect. All right, and then did you take any medicines this morning? None. What medicines do you take on a daily basis?
None.
None. Okay. I'm gonna ask you a bunch of questions. You'll probably say no to every single one of them.
Okay.
Ever had a heart attack before?
No.
Are you able to walk at least 2 blocks on flat ground?
Yeah.
Don't get short of breath or have any chest pain?
No.
Any COPD?
What is that?
You don't have it if you don't know. Sleep apnea? Asthma? No diabetes? Nothing wrong with your liver and kidneys that you know of?
No.
Perfect. Ever had a seizure or stroke?
No.
Ever had a blood clot?
No.
Perfect. Do you use any tobacco products? Any alcohol? Any marijuana or other drug use?
Marijuana.
How much?
A lot.
Okay.
Yeah.
Do you do edibles or do you smoke or vape or?
I do edibles just because the doctor told me to do them.
Okay.
But yeah, so.
No smoking or vaping?
I mostly smoke though.
Okay.
For sure.
How much a day would you say? You can be honest, because
a lot.
The more that you use marijuana, the more anesthesia we have to give you, so we need to know.
A lot, but I ain't really smoked yesterday. I just
Okay, that's okay.
I just
I
took.
thought they told you don't smoke.
But then they told me I can't smoke.
That you can.
But I can't smoke so much.
Mm.
But
Just give me like a ballpark range, like how much on average a day.
Be honest.
I'm trying to figure out how would you want me to explain
How
it.
you want to quantify it?
Right. So
Since you slowed down.
Is it joints, bowls?
they joints.
Joints. How many joints a day?
We could say like.
It's
like
okay. You
4,
can be
like
honest.
4 or 5.
Okay, that's okay.
Well, that's just like in general, or is this based on?
Just like based on like, say you weren't getting surgery, you were just living your daily life. What would you do in a regular day?
Oh yeah, for sure.
Okay.
I had one of these in years.
Yeah, you admiring it. You admiring it. Let me see. Yeah.
Oh my gosh.
Grandma.
You're right in front of me.
Grandma used to
Look, she
love
said,
that.
let me see.
You asked for it.
It's not bothering me though.
Oh, I mean, that's good.
I just wanted to
Bother
see
me.
it. Nah, it's not bothering me. It do look good
They say
though.
they've been up there for 17 years. now.
Yeah, they've been there for a long time.
That's good.
Why you ain't give me one? It's cool. Just
I
save me
gotta come
some.
and get you, right?
Tomorrow?
Yeah, you can get a sandwich tomorrow.
Ah, you thinking about tomorrow. I'm thinking
Well,
about
no,
today.
we got what time do Panera close? Panera 24 hours in here?
I think so. I've gotten stuff pretty late there.
So we got the thing. You can get some.
And because you're staying overnight, right?
I think so.
So
How
as
long-
soon as you get to the room, then you'll be able to, or as soon as you wake up, you can ask for snacks.
Okay.
And then when you get to your room, you can order from a menu.
Okay. So how long is the procedure?
It's scheduled for around 4 to 5 hours.
Oh, okay, that's not bad.
Oh, did they not say?
They probably did. I just don't remember.
Yeah, that's how it is on the schedule. Sometimes it's shorter, sometimes it's longer, just depending on.
And then it's already a delay
Yeah.
in the surgery.
Oh, and so this one wasn't even supposed to be in my room. My room finished early. That's why I thought you were getting in early.
It was supposed to be.
Yeah, it's supposed to be at
They
12.
pushed it back.
It was supposed to be at 12.
Because the person, whoever was doing before
Dr.
her,
Schechter.
couldn't get a robot.
Yeah.
A robot to do the procedure before her.
Mm-hmm.
And that's
Things
what
are
the
making
delay.
sense now.
Yeah.
Things are making sense. Do you mind pulling your mask down? Open your mouth real wide for me. Stick your tongue out. Any teeth loose, chipped, or missing? Perfect.
4 5 hours. 2:55.
And then if you were to receive blood products today in case of emergency, would you be okay receiving them?
Yeah.
Don't anticipate having to use them, but we have tested everybody.
Okay.
Plan for anesthesia today is what we call general anesthesia. So what that means is we'll use this IV. You have to go all the way to sleep. And then when you're all the way to sleep, we'll use a breathing device to help you breathe during the surgery.
Okay.
So how it's going to work is we'll roll you back into the room. It's going to be really cold. There's going to be lots of stuff.
Mm-hmm.
And that's totally normal.
Mm-hmm.
Okay. The nurses in the room will introduce themselves to you. And then we'll get you onto the operating room bed. I'll hook up all my monitors, blood pressure cuff, sticker on your finger, and some stickers on your back since we're working on your chest. And then I'll give you some oxygen to breathe through an oxygen mask. And then we'll say, okay.
That room must be freezing.
It's going to be cold, but we'll get you some blankets as soon as we get in there. And then this fancy purple thing you have on can hook up to a heater. So I hook it up to a heater during the case.
Okay.
But then, once all the monitors are on and we're all good to go, you get plenty of oxygen. We'll say, okay, it's time to go to sleep. And then that's when you'll go to sleep. We'll put medicines in your IV and then get the breathing device in. For whatever reason, if this IV stops working, there's always a chance we put another IV in after you're asleep. But it'll be after you're asleep. You won't even know. You just might wake up with another accessory. When Dr. Schechter's all done doing his thing, we'll wake you up, take the breathing tube out, get you to the recovery area. Anytime we're using any sort of breathing device, always risk of damage to lips, teeth, or gums. That's why I was asking about your teeth. And then we always have to tell everyone there's a small chance that the breathing tube has to stay in for whatever reason we don't feel like it's comfortable to take it out. But that risk is very low. It's just a known risk we have to let you know about. That's a lot. Any questions about anything?
Is the breathing tube gonna hurt?
So the number one complaint afterwards is a sore throat. So when it goes in, you'll be fully asleep. You won't know.
Right.
But whenever you wake up, when it comes out, sometimes people have a sore throat. They feel like they have a tickle. So afterwards, we have cough drops. Sometimes hot water can help. But it's totally normal to wake up with a sore throat. It shouldn't hurt. Sometimes it's just a little irritated from being in there.
Okay. And another thing, Dr. Schechter said I could ask y'all for y'all to get pictures of my tissues and stuff. So he told me to remind y'all.
Yeah. Tell the people from his team that are gonna come by probably. Did you sign the consent form already? Okay. So whenever we go back, someone from his team has to be with us when we go back. Make sure to tell them because they'll be the ones taking the pictures for you. Because after I drop you off in the recovery room, then I say, see you later. And we never see each other again.
Okay.
But Dr. Schechter's team you should see again. So they'll have those pictures for you.
Okay.
Any other questions I can answer? Okay. Any questions from you?
How soon can she move around?
Afterwards? As soon as you're awake enough, you can pretty much do whatever you want. So as soon as you're awake enough to ask for family, ask for something to eat or drink, you can. Usually,
they're not gonna want you to sit in no bed. They don't want you to set up blood clots.
Yeah.
They want you to move around at least a couple of hours.
Now, when it comes to lifting and stuff, that's something that Dr. Schechter's team will let you know about. Usually, they give you a lifting restriction, but they usually encourage people to get up and move around pretty quickly afterwards.
Just some blood clots set up.
Yep.
Okay.
Usually you'll be a little groggy at first, right when you wake up, so you'll be kind of out of it. But once you're not a fall risk, then you can get up and move around.
Okay.
What other questions can I answer?
That's it.
All right.
Wait, I do got a question.
Okay.
Do you gotta take the breather tube out when I wake up?
You want to stay in?
No, I mean like.
You want to be asleep when it comes out?
Yeah.
So the reason we make sure you're awake when you do it is so when we do take it out that you can breathe on your own.
Right. Okay.
So if you're not breathing on your own or for whatever reason we don't feel like you can tolerate having it out, then we won't take it out yet.
Okay.
So come on in. We just finished just answering questions.
So sorry to interrupt. I'm Dr. Kokoma. Dr. Thompson and I work together.
Hey.
Be your anesthesiologist. Who's here with you?
My mom.
Your mom. Good one to bring along.
Okay.
Love it. I'm just going to take a look at your name band real quick. Can you tell me your name and date of birth?
No.
Okay. And what do you like to be called?
Priya.
Priya? Okay. Awesome.
Little sticker on your finger.
And then, anything to eat or drink today?
No.
No? Okay. Any trouble with anesthesia before?
Mm-mm.
Anybody in the family have any trouble with general anesthesia?
Mm-mm. Not that I know of.
No? Okay. All right. Do you have any?
never had to really go under, so.
Okay. Do you have any allergies that you're aware of? No. Okay. And any questions about what we're gonna do today?
No.
No. And do I see that you use cannabis every day?
Yes.
Okay. Did you use any today?
No.
No. Okay. And then any trouble walking a couple blocks on flat ground?
No.
No. Okay. And anybody have any questions? I'll see you in the room, Priya.
Okay.
And then right when we're getting to roll back to the room, I have some medicine I put in your IV. It's basically like an IV Xanax. Takes the edge off when we're getting ready to get started.
Okay.
Okay, and then
Put this on now?
yeah.
Okay.
Well, the room should be ready shortly, so as soon as the room's ready, we'll get on going.
Oh.
So, are you doing a vlog?
Hmm?
Is this
Yeah, I
your
do
camera?
YouTube a little bit.
YouTube?
Yeah.
Is that the same as a vlog?
Yeah.
Okay. I'm like, it's not what I just said.
So you want me to get all my stuff, right?
You can keep your phone and your camera until we're like ready to go.
Okay.
Do you want your phone and camera like as soon as you wake up?
Yeah.
Then we'll just make sure to put it with your stuff
Okay.
before we go. But that's okay. We can do that right before we go.
Okay.
All right. I'll be back when it's time. Okay. All right. If y'all have any questions, just feel free to ask. I can answer on the fly whenever you want.
All right. Thank you.
Mm-hmm.
See, they be in my business. No. Mom, it's about that time. Your hands ashy too, just like mine. What?
Yeah, but the only thing I'll be worried about is when people die, they have to take them to the morgue. Put their heads on the table, put them in the freezer, slide them on the cold tray.
I don't know you have, okay, we'll tuck this under you, look at the other bed.
Yeah, that's the only
Make it a little
thing.
more comfortable.
Maybe in the bag. You might have to help put them in the bag.
Ready, 1, 2, 3.
Yeah. That's the whole thing. But that's all they do. They need to go down, get an x-ray or any procedure. They come get you, take you there, bring you back. That's it. And I ain't know they left. They up left. I'm finna slide over. Oh, I'm in the way.
Okay, we're gonna pull you on over into the bed, okay? You don't need to do anything, you can just lay there.
1, 2, 3. Good job.
You say what?
Probably do a couple rolls back and forth to get all these blankets out from under you.
What you say? You moving too much. You moving too much. What you doing?
I'm under your.
You want shallow.